So this very commonly prescribed medication in urgent cares can be very dangerous for kids. It's Tessalon Perles. We're approaching respiratory season. People have coughs. Coughs are annoying. What do you get? Tessalon Perles. Now, how does it work? It's a local anesthetic. It's an ester type of anesthetic. And you remember your amide anesthetics have two I's like lidocaine, etc. And your ester anesthetics like tetracaine or cocaine, right? Those are your ester anesthetics, but I digress. How can it be dangerous in kids? If they chew it, you can get local anesthesia, right? You can get bronchospasm. You can become an aspiration risk, right? That's one thing. But there's also a component here, like a lot of these anesthetics, you get sodium channel blockade, which can be dangerous, less so in adults if they chew it, but in a child, especially if it's absorbed in their mucosa in their mouth or their esophagus or things like that, you get sodium channel blockade. What are other things in overdose and toxic that can cause sodium channel blockade in kids? Benadryl is a good example, right? And usually we will be tested, or they will present to you with like a wide, complex tachydysrhythmia, like super wide. What the heck is going on? That's obviously not super compatible with living. So whenever I see people this time of year, Tessalon Perles or whatever kind of cough suppressant or expectorant you want to use, sure, it's fair to do. But take 2 seconds and say, hey, any kids at home, always good to be safe about where your medications are stored, right? Tessalon Perles or Mima's phenobarbital or amiodarone or blood thinners or Suboxone or Subutex, whatever. It's always important to know where your medications are. But for these seemingly harmless medications, they might not guard as quickly, or people will use medications for other people, right? A parent who works in a daycare might have a cough and take Tessalon Perles and well-intentionally give the Tessalon Perles to their child, their 1 or 2 year old, to see if they can get their cough to stop so they can sleep at night. But that can be very dangerous. So in summary, it's always good to know your drugs, but Tessalon Perles, dangerously in higher doses, sodium channel blockade, bad for heart, bad for child, or local anesthetic, bronchospasm, aspiration risk, stuff like that. Know your drugs.